Great. I'm so pleased to be here, to be invited in to share some thoughts with you. Everyone's telling me it's a really hard format, and I came in rather naively. Let's begin. So my name is Tlesla Evan Adams. This is my great-grandfather. His name was Atum Charlie Adams. We're First Nations people. This picture was taken in 1930. He was born in 1860, and in 1862, a smallpox epidemic swept through his village, Comox, destroying that population, and it was later repopulated by Kwakwaka'wakw-speaking people from the north. But it blinded him, and it really kind of shows to me the history of disease in the province of BC. This is my family with my father and mother. I'm the little boy sitting in my dad's lap. When I was 6 years old, one of my sisters was killed by a boy next door while we were out playing. And I knew that our places where we live were meant to be much more organized than they were. Our healthcare system for First Nations people in Canada is unique. It's run by the federal government and not by the provinces. So we have a healthcare system unlike that of other British Columbians. First Nations people number about 250,000. We're from 26 different cultural groups, 32 distinct languages, 203 communities. Some of us First Nations, some of us Métis, some of us Inuit. And we are a unique and distinct population in that we are original peoples. For us as First Nations people, we live in two worlds. We look backwards at our glorious past, when we roamed freely, when we spoke our own languages, when we lived undisturbed in our territories. And we live in today with our modern challenges. And this soulfish is a representation of us looking forward and back at the same time. And for modern First Nations people, they wonder, are we traditional people, or are we people who are modern or from the future? And it's kind of crazy-making, or maybe it's even kind of cool. But certainly modern Indigenous people must reconcile. They must make peace with their timeless inheritance. The province of British Columbia and First Nations people and the country of Canada have signed a new relationship accord with a capital N and a capital R to bring our different peoples together so that we can live in harmony. Imagine signing a new deal in this day and age. Nothing about us without us is one of our slogans, and that policy about people should not be decided without them being present at the table. One way that this is typified is that before, Aboriginal women used to be tied to their beds in order to deliver their babies when they wanted to squat. And that policy was decided not by Indigenous women, but by caregivers who were perhaps a bit misguided. One of the most important meetings that I attended once was with the chief coroner in fighting with the chief about the return of an infant's body. The chief coroner said, by law, by BC's Coroners Act, I'm allowed to keep this infant's body as long as I deem fit in order to determine a cause of death. And the chief said, we know you think you're in charge, but we think that's our baby. Our First Nations leadership voted that we could, in fact, look after ourselves and that we could run the health system that occurs on our reserves. It was quite a memorable moment, and so here in this province, First Nations people run the First Nations Health Authority. We signed a BC tripartite framework agreement that transferred Health Canada's assets to First Nations people. It's a deal worth about $500 million a year. And we now have 500 staff, about a third of them who are First Nations, who work on First Nations health. And as you may know, First Nations people have the worst health of any ethnic group in the province of British Columbia. The Provincial Health Officer said the province will have a significant role with First Nations Health Authority officers as they develop their roles and establish reciprocal accountability. And the Provincial Health Officer, Dr. Perry Kendall, by law is required to report on the health of Aboriginal people. This is one of our startling statistics. This is a look at HIV-related mortality from 1993 on the left all the way to 2006 on the right. The bottom line is HIV-related mortality for non-Aboriginal people in BC. You see a clear downward trend. For us, it was still going up, even in spite of highly active antiretroviral therapy. And of course, as Aboriginal people, we're not the only ones involved in our own healthcare. The province of BC has 100,000 healthcare workers who are meant to look after all British Columbians, not all British Columbians minus the Indians. We've spoken to tens of thousands of Indigenous people, and they said, we know that the heart and the mind and the body and the spirit are connected. And we would like a healthcare system that is holistic in its approach and that's inclusive of our families and our communities. In fact, in my language, the word for tree is also the same word for cousin. It's jeja, and it signifies that our hands, that we hold hands under the ground, even though we are individuals. And we would like a world where we are at peace, where we are equal, where we are surrounded by beauty, where we are allowed to be open and to be respected, where we are safe and where we are loved. And we would like, of course, as well, to be able to look at ourselves, to see ourselves honestly, to drive our own health and well-being, and to see our strengths and weaknesses, for sure, and to see our own beauty. I'm reminded of the words of Dr. Kamara Jones in her seminal work, Undoing Racism, in which she describes a gardener that notices that pink flowers flourish while red flowers languish or grow shorter. And she has forgotten her original decision to grow the flowers in different parts of the garden, one in rich soil and one in poor soil. So let me be clear, you are the gardener. And I always remember a minister that I worked with when we were looking at transgendered health, and he said, we're in charge of this. And what I wanted to say was, yes, we look after all British Columbians, not just the ones we like. So my dream is for a healthcare system for all of us, a healthcare system that's safe, that's respectful, that's inclusive, one that includes my cohort of 250,000 original peoples, one that my people believe in, that they trust with the care and well-being of themselves and their families. Thank you.